Hi all. So my project that I did on the disease that I chose was endometriosis. If you don't know what endometriosis is, earlier we discussed in the beginning of module 5 of endometriosis and PCOS. It is when extra tissue of the lining that goes along the lining of the uterus is supposed to grow inside the uterus, but instead endometriosis is where the extra tissue grows outside of the uterus and along the fallopian tubes and ovaries. Not only that, often it can grow outside into intestines, colon, and in the bladder. So endometriosis, there is no known cause for it. Medical professionals are not as educated on endometriosis as they should. It is very common in women. We'll get to that later. But most health professionals have theories as to how and what causes endometriosis. One theory is that endometrial tissue is distributed from the uterus to other parts of the body through the lymph or blood systems, creating abnormal blood flow, abnormal function to the lymph nodes. Some medical professionals have that theory. There are also genetic theories. 1 in 10 women are diagnosed with endometriosis. Usually those diagnosed with endo, they either have relatives such as sisters, mothers, grandmothers, aunts even, who have endo, and most likely it will be passed on to further generations. Another theory is that remnants of tissue from a woman who was an embryo may later develop into endometriosis, or that some adult tissue retains the ability they had in the embryo stage to transform under certain circumstances. Professionals also believe the main cause of endometriosis is retrograde menstrual flow, where some of the tissue that sheds during menstrual cycles flows through the fallopian tubes into other areas of the body, such as the pelvis, so other areas besides the uterus, and through the vaginal canal. Although it has not yet been classified as an autoimmune condition, many healthcare professionals are considering it as an autoimmune disease due to the inflammatory nature of endometriosis, and that it seems to trigger an imbalance to the immune system. With that being said, the symptoms of endometriosis vary depending on the woman. Studies have found that women may experience the following, such as painful menstrual cramps more than a normal period, which is, how can we identify a normal period? Well, these menstrual cramps refrain from women of getting out of bed. They cause vomiting, diarrhea, more painful than some women will compare it to childbirth, and will increase over time as they get older. Pain during and after sexual intercourse. Pain in the abdominal area, also the pelvic area, aside from having cramps. So some women may also experience cramping when they have finished their menstrual cycle or even before their menstrual cycle, but an excessive amount of pain. Painful bowel movements or painful urination during or in between menstrual periods is also a symptom. Constipation, diarrhea, nausea, and vomiting, and other GI symptoms that can lead to a bowel disorder, just because endometriosis can travel to the bowels. Heavy menstrual periods, some women will think that they are bleeding out and eventually will become anemic, which is also a possibility just because of the heavy menstrual flow. Spotting or bleeding between periods is also a symptom. Painful bladder syndrome, which is a chronic condition, bladder condition that will cause pressure and bladder pain, and will often sometimes be ruled out as a UTI, which in this case it's not. A lot of women will experience a fatigue because they spent so much energy just trying to fight this pain, and fatigue is one of the many common symptoms of endometriosis. Lastly, infertility or difficulty getting pregnant can also be a symptom of endometriosis. Usually, a lot of women do find out they have endometriosis when they are trying to get pregnant, and they often find out that they're not able to conceive. There are multiple treatments for endometriosis, but they're very limited because endometriosis is not very well known, and a lot of medical professionals are often dismissive on this particular disease. Self-care treatments involve pain medications such as over-the-counter medications that are non-steroidal anti-inflammatory drugs such as ibuprofen or Tylenol. Other medication treatments involve hormone therapy, which will sometimes put women through medicinal menopause. There are various types of hormonal therapies that some with endometriosis can be on. One can involve oral contraceptives or birth control that have combined estrogen and progestin hormones that prevent ovulation and reduce menstrual flow. Another is being given progestin itself, which most birth control contains. What a lot of medical professionals do